Good afternoon, everyone. My name is Laura Morell, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on November 4th, 2020. Next slide. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Next slide, please. Today's presentations will address one or more of the following 5 objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Next slide. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses and partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. The course access code is OneHealth 2020. To receive free CE for today's webcast, complete the evaluation at cdc.gov/TCE online by December 9th, 2020. A web on-demand recording of today's webinar will be posted online at cdc.gov/onehealth/2020/november.html by December 10th, 2020. To receive free CE for the web on-demand video of today's webinar, complete the evaluation at cdc.gov/TCE online by December 10th, 2022. Next slide. Before we begin today's presentations, Dr. Ryan McLaren-Wallace, Deputy Director of CDC's One Health Office, will share some news and updates. You may start when you're ready.
Hi, everybody. Thank you for joining us on today's ZOHU call. We appreciate your help in spreading the word about ZOHU by sharing the website link with your colleagues from human, animal, and environmental and other relevant health sectors. Before our presentation, I'm going to share with you a few highlights from today's ZOHU call email newsletter. If you're not yet subscribed, please use the link at the top of the main ZOHU webpage to register. So CDC's response to the COVID-19 outbreak continues to evolve. Please check CDC's website for the latest guidance and resources, including information about pets and other animals. The CDC One Health Federal Interagency COVID-19 Coordination Group continues to bring together representatives from 18 key federal agencies for regular meetings to share news and updates, including publications and guidance on the One Health aspects of COVID-19. There's also an open forum version of this call, the One Health Partners COVID-19 webinar, which is taking place monthly to provide the latest information on news and key updates on the One Health aspects of COVID-19, as well as the guidance and resources for public health officials, animal health officials, veterinarians, and pet owners. This webinar also summarizes the domestic and global animal cases of SARS-CoV-2 infections and describes ongoing coordination around the One Health aspects of COVID-19 in the United States. One of the presentations today is going to provide a lot of detail on the animal cases in the US, so I'm only going to give a high-level overview of those cases right now. At this time, 121 animals in 15 countries have tested positive for SARS-CoV-2. 265 mink farms in 6 countries have reported animals testing positive. This includes 183 in Denmark, 68 in the Netherlands, 11 in the United States, 1 in Spain, 1 in Sweden, and 1 in Italy. In the United States, 84 animals have tested positive. Based on the limited information available to date, the risk of animals spreading COVID-19 to people is considered to be low. However, it does appear that the virus can spread from people to animals in certain situations. So our guidance is unchanged from the last ZOHU call. It is to keep people and animals healthy, treat pets as you would other human family members, including avoiding direct contact with your pets if you have COVID-19, and do not let pets interact with people outside of the household. Next slide, please. Here are a few more One Health highlights to mention. The new National Action Plan for Combating Antibiotic-Resistant Bacteria presents a coordinated strategic action that the U.S. government will take in the next 5 years to improve the health and well-being of all Americans by changing the course of antibiotic resistance. This plan is available online and you can review it in detail. Also check out CDC's new Environmental Health Capacity Program, which provides funding to increase the capacity of health department and environmental health programs. Environmental health capacity is a crucial part of protecting the nation's public health. And more information on this can also be found on CDC's website. And the National Association of County and City Health Officials and the Conference for Food Protection is looking for new recruits for their advisory group. More information can be found on the NACCHO website. Next slide, please. The Journal of American Mosquito Control Association has posted a special issue on natural disasters and mosquito control. And please check out several upcoming observances of events of interest, including One Health Day and US Antibiotic Awareness Week in November. Next slide, please. There are 2 new E. coli outbreaks of unknown sources and a new outbreak of Listeria linked to deli meat that have been posted on CDC's website. Our next call will take place on December 2nd. Please email topic suggestions for future presentations and news from your organization to zohucall@cdc.gov. And I'll now turn the call back over to Laura.
Thank you. Next slide, please. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation. Next slide. Our first presentation, AVMA Antimicrobial Resistance in Animal Pathogens Report, will be given by Dr. Paul J. Plummer and Dr. Megan Nichols. Please begin when you're ready.
Good afternoon, everyone, and thank you so much for the opportunity to speak today. I know myself and Dr. Plummer are very excited to talk a little bit more about the report. Next slide, please. The CDC Antibiotic Resistance Threats Report in the United States was released in 2019 and details the CDC analysis of the state of antibiotic resistance in the United States. This report includes a new baseline of antibiotic resistance and reports that more than 2.8 million antibiotic-resistant infections occur in the United States each year, and more than 35,000 people die as a result. Next. The report also lists the top 18 pathogens, including bacteria and fungi, that can be harmful, and they're categorized into 3 different levels of concern to human health: urgent, serious, and concerning. And there are conservative estimates of deaths and infections related to AR in each of these in the report. The 2019 report also includes current scientific gaps, the latest action that can be taken to address antimicrobial resistance threats, and some of the actions needed. There's also a watch list that identifies 3 threats where the full burden of disease is unknown and the true impact needs to be better understood in the United States. Next. This report also highlights the interconnectedness of the threat of antibiotic resistance across the One Health spectrum, including the impacts to human health resulting from antibiotic resistance in animals and the environment. Next slide. As a veterinarian at CDC, I'm often asked which of the bacteria in the 2019 CDC threats report are also a concern to animal health. Although there are some bacteria in the 2019 threats report which are zoonotic, the CDC report really details threats to human health. This was one of the genesis of the ideas behind creating a report that really details bacterial pathogens of concern to animal health. Although some of the pathogens appear in both documents, and you see that depicted on this slide, it is helpful to see the pathogens which appear only in one report and not the other. Some of the bacteria are not known to be zoonotic, and some actually don't result in a significant antibiotic-resistant disease burden in humans or in animals. Next slide. However, what I will say about both reports is that there are current challenges that are faced in both human and veterinary healthcare. And looking at the CDC report, there are some challenges that I think we have a unique opportunity to learn from on the veterinary side and how it relates to our healthcare practices. And with that, I'll turn it over to Dr. Plummer. Next slide, please.
I appreciate Dr. Nichols. As Dr. Nichols mentioned, my name is Paul Plummer. I'm the Executive Director at the National Institute for Antimicrobial Resistance Research and Education, and also a professor at the Iowa State University College of Veterinary Medicine. Today, we're going to update you on this antimicrobial resistant pathogens affecting animal health in the United States report that the American Veterinary Medical Association recently released. Next slide, please. So the goal of this report is, as Megan mentioned, to really try and provide a parallel report to the CDC threats document focused on animal pathogens for which antimicrobial resistance is emerging and becoming a concern. So it's designed to highlight the growing importance of antimicrobial resistance in veterinary medicine, to identify specific bacteria responsible for animal disease that show evidence of increasing resistance, to help reinforce those control measures that we can take as veterinarians to help mitigate these risks, which, as Megan mentioned, often parallel those used in human medicine, and really to serve as a resource for veterinarians in helping to make informed antimicrobial stewardship decisions. The report also provides a baseline for efforts to identify and monitor select bacterial pathogens and their impact on animal health as it relates to antimicrobial resistance. Next slide. First, some quick definitions that we want to address. In this report, we focus only on acquired resistance. That is, resistance that is identified in organisms for which an antimicrobial previously worked to kill an organism, and that antimicrobial loses its effectiveness. Although some bacteria have intrinsic resistance to antimicrobials, and we do address that very briefly, the focus of the report is on acquired resistance for these animal pathogens to antimicrobials used to treat them in clinical situations. Next slide. I also want to address that the report evaluates and includes data on several different testing modalities. And so I just very quickly want to highlight those for the audience. We include both antimicrobial susceptibility testing, AST, and also genotypic testing in identification of these animal pathogens that are of rising concern. As the audience probably recognizes, antimicrobial susceptibility testing is focused on evaluating phenotypes by exposing those bacteria to varying concentrations of the antibiotic. These identify a minimal inhibitory concentration, and they're often reported out as susceptible, intermediate, or resistant based on breakpoints designed and managed by the Clinical and Laboratory Standards Institute. I also wanted to highlight the Vet 09 CLSI document that's pictured here, which was recently released and provides an excellent resource for veterinarians in helping to understand AST testing in their clinical practice. Next slide. In addition to AST testing, we also included data related to increasing identification of genotypic resistance. In this case, those resistances are based on identification of genetic markers of resistance. And we want to emphasize that those do not always correlate with phenotypic resistance evaluated in AST. However, for the purposes of the report and for clinical decision-making, an awareness of the veterinarian for increased potential or heightened potential for resistance due to genetic resistance markers is valuable and thus was included in the report. Next slide. So the report is designed to help veterinarians make informed decisions by knowing the situation. It includes both phenotypic and genotypic resistance data, and recognizing that both tests have limitations, they do both help provide clinician awareness. However, we also want to emphasize that clinical decisions should be based on the full understanding of the data, patient history, and other guidance documents and clinical experience when making that antimicrobial stewardship decision for which antimicrobial to use in a particular disease process for an animal. Next slide. So obviously, most of the participants are aware of antimicrobial stewardship. There's quite a bit of effort that through CDC and AVMA to address this. And I simply wanted to point out with this slide that antimicrobial stewardship definition and core principles have been developed by the American Veterinary Medical Association. Those are available on the AVMA website, but are also included in this report. For the purposes of today, we won't dive into the specifics of those, but I would encourage you to go look at the report if you're interested in more specifics as it relates to veterinary medicine. Next slide. Those core principles are outlined here, and again, very much mirror and parallel those outlined in the core principles for antimicrobial stewardship on the human side from CDC and others. Next slide. So now briefly to comment on the report. The report is structured for ease of use and very much follows the approach used in the CDC threats document. In section 1, there's an introduction and a couple of infographics that are helpful for users to summarize the information. In section 2, we divide up and have a page for each host species of animal that we're talking about in the report that summarizes all of the outcomes for that particular host species. Then in section 3, we have specific bacterial fact sheets for each bacterial species, again grouped by host species. And in section 4, a technical appendix for each bacterial species. So in the next couple of slides, we'll briefly go through each of these sections just to give you a picture of what the report is built up from. Next slide. So as I mentioned in the very first portion, there's a summary that includes much of the background information we provided here today on intrinsic versus acquired resistance, the AST versus genotypic resistance, and a little bit of the motivation. We also include a couple of important infographics. There's an infographic on antimicrobial stewardship that you can see on the backside. Paper there that can be downloaded and posted in a pharmacy area or in a ambulatory veterinary truck. And then we also have an infographic that basically summarizes the entire report in terms of both host species, antibiotic, and bacterial species combinations for which resistance has been identified as an increasing concern. So this table summarizes the totality of the report and provides a quick reference that can be downloaded and laminated and kept handy for the veterinarian in practice to use when considering treatment decisions. Next slide. In this section, we have a host species summary for each of those host species. In a minute here, we'll click through those and see all of the different host species, but just from a very high level view, you can see this one for dogs and cats. On the left-hand side, you can see that we list the pathogens of concern that were identified by the report. We have some important what you need to know type of highlights, and then what brief summary of what veterinarians can do to address this broadly at the host species level. So now, if you can just click through these as they come up, there's dogs and cats. And there's one for cattle, chickens and turkeys, equine, sheep and goats, swine, and fish and shrimp. You'll notice that each of these is also color-coded color-coded at the bottom of the page, and that defines the host species, and that color coding maintains throughout the remainder of the document to assist people, veterinarians in finding the next higher level or more in-depth information. So now we'll go to section 3 on the next slide. In section 3, you can see again that host species color coding at the bottom, as well as the species designation there at the top with a small graphic. And at this level, we have a pathogen card for each pathogen, very similar to what's used in the CDC document. So you can see this is for Staphylococcus species. And if you click, there's some pop-ups here that will come up and highlight a couple of areas. So there's a section on what you need to know, the key facts at a high level related to these organisms in this host species. The next one is prevention actions, again specific. Some of these are overarching, but they relate specifically to helping to control this particular pathogen, transmission, hospital-acquired infections, or other resistance issues. And then finally, the last one to pop up here is the resistance profile. These resistance profiles have a list of organisms for which, antibiotics for which increasing resistance has been identified. We need to emphasize that this does not mean that all bacterial species isolated from animals of this particular species have these resistance markers. However, it does provide a good starting place to consider what antibiotics are high risk for potential resistance in this bacterial species. Next slide. Finally, in the fourth portion of the report, this is our technical appendix. Again, we have one of these for each of these bacterial species by host species comparison. So you can see again at the bottom the color coding to demonstrate that this is for dogs and cats. This is the Staphylococcus species. So this is the technical appendix for the bacterial pathogen card you saw on this previous slide. And this goes into more depth. This provides the scientific rationale for why we have concern here, more information on whether our concern is based on AST or genotypic testing or both, provides some additional resources that folks can dig in a little bit deeper, and some high-level comments about its impact on animal health and current actions being taken by the veterinary profession to address this resistance. This technical appendix has one of these for each bacterial pathogen that has its own bacterial card in the previous section, and all the way back to that first table in the infographic we showed. For each dot that was on that table, there's a technical appendix that details the highest level of information around each of these organisms in their host species. Next slide. So with that being said, the report is available at the AVMA website. The URL is here, but you can also search for AVMA antimicrobials, and that will take you to the Committee on Antimicrobials landing page. From there, you can see other resources that AVMA has developed related to antimicrobials and antimicrobial stewardship, as well as the webpage link for this report and additional links for downloading sub-portions of the report or the report in its entirety. It's freely available. You do not have to be an AVMA member, so anybody can go to the website, access the report, and we would highly suggest that you do that if you have interest in this area. Next slide. I think that finishes us up. One last slide here. So just to point out that we have a couple other resources there, some stewardship checklists, some do's and don'ts kind of posters, and then some client education posters around antimicrobial therapy, particularly for cats and dogs. And with that, we'll finish up, and we'll be happy to answer questions at the end if we have time.
Thank you. Next slide, please. Our next presentation, a toolkit for conducting One Health epidemiological investigations in animals with SARS-CoV-2, is by Dr. Ria R. Guy. Please begin when you're ready.
Thanks so much, Laura. Can we go to the next slide, please? So I wanted to start by showing you a quick summary of the presently available research that we are aware of, both published and preprint, on animals that are susceptible to SARS-CoV-2. And that's what you see summarized here. So the numbers on each animal represent the number of preprint articles or published articles corresponding to that animal. And animals in green have been determined to be susceptible to infection either experimentally or under natural conditions. The animals in yellow, we have classed as moderately susceptible, either because only a subset of animals challenged under laboratory conditions became infected, or if the study included a transmission experiment, the species was not able to transmit the infection to other members of their species. We also know that insect vectors like mosquitoes and midges, wild-type lab mice, pigs, and poultry are all suggested not to be susceptible to SARS-CoV-2 under laboratory conditions, and there's been no reports of these animals being infected naturally. Next slide, please. So at the beginning of the call today, Dr. Wallace mentioned that there'd be a bit more of an update on animal cases. So this slide is essentially showing you what we know about naturally occurring SARS-CoV-2 infections in animals, both globally and domestically. So to date, as Dr. Wallace mentioned, we know that 121 animals from 15 countries have been reported infected with SARS-CoV-2. And the earliest of those date back to February 2020. Primarily, these are cats and dogs, but we've also seen reports in big cats in zoological facilities. And in fact, the first cases of SARS-CoV-2 in any animal in the United States was 4 tigers and 3 lions from the Bronx Zoo in New York City, which was the focus of one of the October ZOHU call presentations and is available online if you're interested in learning more about that. 84 of the 121 animals reported globally are from the United States, or 69%. And this is, of course, because we've had many human cases of COVID-19 in the United States, but also because there are many active surveillance efforts trying to uncover the true burden of disease in the United States. Not included on this slide, we also know that there are outbreaks on mink farms, and affected mink farms have been discovered in both Europe and the United States. And SARS-CoV-2 in mink causes respiratory signs and in some cases mortality in those animals. Next slide, please. So taking a quick step back to show you the full global picture of all countries that have reported SARS-CoV-2 in any animal. That's what we're showing here. And we know these results are, of course, limited by surveillance and detection efforts, but based on available information, the first reported case in any animal occurred in Hong Kong in February. And since this time, 15 other countries, including Sweden, Canada, Italy, and Chile most recently, have followed suit with animal cases. Next slide, please. So before jumping into some guidance and recommendations that I'd like to present today, I wanted to share with you our current recommendations, and then I'll take you through in a bit more detail, including looping back on how we've landed on this guidance. So based on the information we have on hand, both the experimental infection data in animals under laboratory conditions that I showed first, and animal cases that have become naturally infected through exposure to a person with COVID-19, it appears that the virus that causes COVID-19, SARS-CoV-2, is indeed zoonotic and can infect some species of animals, specifically mammals. And to date, our evidence suggests that naturally occurring transmission events are mostly directional, occurring from people to animals in some circumstances, where animals have close contact with people with COVID-19. However, to date, there's no evidence that animals play a significant role in spreading the pathogen, and that means there's no justification to take any measures against animals that would compromise their welfare. And this certainly includes attempts to disinfect pets with wipes or chemicals that aren't approved for use on pets, since we have no evidence that pets can act as fomites for this virus. Next slide, please. So today I'd like to take you through a little bit of guidance that we've posted online on our website. So this is actually a screenshot of CDC's COVID-19 webpage, and you'll see Pets and Other Animals tab. And if you click on this tab, you'll get to this page, which is essentially our launchpad for all information and guidance on the One Health and zoonotic aspects of COVID-19. If you click 3 times, we'll highlight here 3 different guidance documents in particular. These are all companion documents to each other. The one that I'd like to dive into a bit more today, if you wouldn't mind clicking, is the guidance that we have for public health vets and animal health officials. And these are really our heavy duty recommendations for how to manage an animal case with suspected or confirmed SARS-CoV-2. But we also have guidance for other groups, specifically veterinarians and veterinary facilities that might see animals that come from households where people have COVID-19. Ryan Wallace actually presented on this guidance during the May ZOHU, if you're interested in learning more about the veterinary guidance that we have online. And then we also have guidance for pet owners if they have an animal that's tested for and been discovered to be positive for SARS-CoV-2. All 3 of these guidance documents have similar messages and provide similar recommendations, but they vary based on the depth of information for the target audience. So now that we know how to find this guidance document, I'd like to just quickly introduce today a document called Toolkit for a One Health approach to address companion animals with SARS-CoV-2. The audience for this document is meant to be state and local public health and animal health officials involved in managing companion animals with SARS-CoV-2. And its intent is to provide recommendations on how to manage animals with SARS-CoV-2, regardless of whether the animal is quite ill and requires veterinary care, or is more typically exhibiting only mild symptoms of illness and can be managed at home. Next slide, please. The guidance starts with a pretty handy checklist of all the things to get in order for preparation for an animal case, and really shows the level of coordination and organization that goes into appropriate case management for an animal that tests positive for SARS-CoV-2. And since this guidance has been available since June, and we've seen animal cases in the United States since April, most local and state jurisdictions that we've been working with have already made plans and preparations at this point for SARS-CoV-2 cases. So this list really serves to emphasize some of the excellent work that's occurring through our state public health veterinarians and state animal health officials, as well as others here in the United States that are managing animal cases of SARS-CoV-2. As you can see from this list, the toolkit is more lengthy than I'll have time to go through in detail in this presentation, but I'd encourage you to have a look online if you're interested in learning more. And here I'll just hit on a few high points from the toolkit. Next slide, please. So one of the pinnacle points that this document attempts to lay out is the collaboration that needs to occur between partners, which is really key for a successful and impactful response to an animal case with SARS-CoV-2. This includes coordination between local partners, such as veterinarians that might be seeing these animals and relaying information back to their owners, the state, and federal partners. And we lay this out into 3 sections, one for making plans and preparations, which is prepare, one for when a case emerges and the health official is faced with managing it, which is manage, and then the third for when an animal case can return to normal activity, which is end management. And I'll take you through all 3 in sequence. Next slide, please. So here are a few essential activities a health official would need to consider in order to prepare for an animal with SARS-CoV-2, including if and when the animal should be tested in the first place, and plans for when an animal is positive, if an animal is positive, how to ensure that it can receive care in a safe manner. Next slide, please. So I'd like to highlight here our recommendations for when to test an animal. This was one of our earliest pieces of guidance and one of the most critical for being able to triage limited resources for animal testing. It's another document that's available on the CDC website using the hyperlink that you see on the slide. And since we're speaking specifically about companion animals here, criteria A, B, and D are most applicable, since criteria C relates to threatened or endangered wild species. In general, when we're thinking about testing an animal, we're recommending they meet two criteria. The first is that they should have an epidemiological link to the virus in some form or another, such as a person or an animal that's known to have been infected with SARS-CoV-2, or otherwise contact with an environment that's considered high risk for transmission, such as a prison or healthcare facility or a hospital. And second, the animal should have clinical signs that are new and resemble what we've seen for SARS-CoV-2 so far. And that's what I'm showing on the right-hand side here. The clinical picture of SARS-CoV-2 is not yet well defined since it's still a new disease. But on that right side, we do show signs that we have seen animals to exhibit when they're positive for SARS-CoV-2. And as you can see, the clinical presentation is somewhat nonspecific. So this is where clinical judgment and ensuring the animal has had some sort of exposure to warrant testing becomes important. Next slide, please. So moving on, I'd like to just quickly touch on some of the activities if an animal actually does present with SARS-CoV-2 in a health official's jurisdiction. Generally, we're dividing management up into two options. One is if the animal is unwell and in need of veterinary care, in which case we provide recommendations and best practices for the veterinary facilities on keeping a sick and test positive animal isolated. But more commonly, we also provide guidance for animals that have a mild illness, which is what we see more often, in which cases can be monitored and isolated at home. And I'll cover both in just a little bit of detail. Next slide, please. So if the decision is made to hospitalize an animal at a veterinary facility because it is sick and positive for SARS-CoV-2, we provide recommendations for the vet facility to safely manage the case. And these recommendations align with the guidance that's already available that I mentioned earlier on the website specifically for veterinarians. We also do present a PPE table for recommendations for veterinarians or health officials that will be interacting with that test positive animal. And given that the animal is known to be infected with SARS-CoV-2, we do recommend full PPE, regardless of whether the procedure is aerosol generating or not, which for respiratory pathogens is a face shield, gloves, gown or overalls, and an N95 respirator or suitable alternative. I will note though that there's some wiggle room built into the footnotes of this table, understanding that especially N95 respirators can be in short availability. So in the footnotes, there's actually a link to a blog that provides information on situations where individuals must wear an unfit tested N95. It's not a common recommendation, but in an emergency situation, the blog is available. And there's also wiggle room in that if an N95 is not available, a surgical mask and full face shield are an acceptable alternative. Next slide, please. If an animal is healthy or is exhibiting only mild signs of illness, our recommendations are essentially parallel to what CDC is recommending for human COVID-19 patients with uncomplicated illness. And that's to separate from others in the household as much as possible, which in the case of an animal could mean putting the companion animal in an area that people are not using. And additionally, since pets sometimes can mask signs of illness and can't tell us how sick they might feel, we also have some monitoring recommendations. Specifically, we suggest daily monitoring to ensure their condition doesn't worsen and does require veterinary care. And this can be achieved with a pet symptom log like the one we show here. Finally, we also do recommend some movement restrictions while the animal is in isolation with SARS-CoV-2, such as taking dogs for short walks and keeping them on leash and 6 feet away from other people or animals. Next slide, please. And then finally, one of the most important pieces of guidance that's provided in this management section is on conducting an epidemiological investigation, which is really critical for furthering our understanding of how animals come to be infected with SARS-CoV-2 and the risk animals pose of onward transmission to other animals. In particular, it seems we're starting to have fairly good resolution on human to animal transmission, but we're just beginning to understand animal to animal transmission. And to date, there's only one report of animal to human transmission, which occurred on a mink farm in the Netherlands. So conducting comprehensive epidemiological investigations can really help us fill these and other gaps in our knowledge, including viral incubation period, shedding duration, clinical presentation in different animal species. Next slide, please. So by request of local and state partners, we've developed a data collection tool. It's a PDF fillable document. It's called the One Health Case Investigation Form for animals with suspected or confirmed SARS-CoV-2. And we've made this data collection tool available to our One Health partners and governance. As you can see here, there are sections in white and also mint green. In an ideal situation, the entire form would be completed, but understanding that resources and time can sometimes be limited, the mint green sections are the ones we've deemed most critical for investigations. And the form does include other sections not shown here, including supplemental pages and useful resources, as well as a supplemental document if there are other animals in the home that are sick with SARS-CoV-2. Next slide, please. So now I'd like to move on to the last section of the toolkit guidance, which is on how to end management of an animal case. One of the big questions in people is when someone who's been sick with COVID-19 can resume their daily lives and end isolation. And these guidelines parallel those for people and allow an animal that's confirmed to have SARS-CoV-2 to end that monitoring, isolation, and movement restrictions. So our recommendations are twofold. First, an animal has to be healthy with no clinical signs present for at least 3 days. And that's without the aid of medications intended to alleviate symptoms. And then second, one additional condition must be met, either at least 14 days since their last positive test for SARS-CoV-2, or if follow-up sampling was conducted, all follow-up samples test negative for SARS-CoV-2. So I'd just like to provide a short bit of information about what we've learned from all of the data that we've gathered through these case investigations conducted in partnership with local, state, and federal partners. I'll start with giving you just a quick recap of what cases in the United States look like in terms of state-by-state distribution. One thing to note here is that states with high animal numbers may have those numbers because they're implementing different types of surveillance. For example, we mostly hear about animals with SARS-CoV-2 through passive surveillance, but where a sick, and that's where a sick animal is tested and then reported onwards. But in some states like Texas and New York, as an example, there are active surveillance programs that are intentionally finding animals with SARS-CoV-2 through research investigations. And we're lucky to be able to hear about one such investigation right after this presentation by Dr. Sarah Hamer. Next slide, please. One of the most compelling pieces of information we've gathered through these EPI investigations is that a strong majority, 95% of companion animals in the US have contracted SARS-CoV-2 through an epidemiological link to a known COVID-19 person. Most often, companion animals have been detected through surveillance efforts, are household pets, and in most circumstances, the person they were exposed to was their owner. We also know that based on our data, these companion animals tend to develop illness 5 to 10 days after their owner was sick. Next slide, please. And then finally, we've also gleaned some more information on the clinical presentation in animals. So across all companion animals in the US, about 57% were asymptomatic, meaning they didn't show any signs of illness, while 32% had some signs of illness. We're still learning, though, how skewed these numbers are by the way the animal cases are reported. So, for example, passive surveillance is more likely to detect symptomatic animals, while active investigations like household transmission studies might give us a better sense of the true prevalence of this virus in companion animals and how frequently they're ill. When animals are ill, however, the majority, 60%, show respiratory signs like fever, sneezing, coughing, and runny nose. 11% have nonspecific signs like fever and lethargy, and 3% only have gastrointestinal signs like vomiting and diarrhea. So with this, I'd just like to conclude. Next slide, please. With a few of our key public health messages, which I've already touched on here, which is to treat animals like you would any other member of your household if you do have COVID-19. And if you are sick, to isolate away from your animal. And if you do have to care for your animal, wear a mask while you're around them, wash your hands. Thank you. That's all for me. And I will hand it back to Laura.
Thank you. Next slide, please. Our final presentation, Texas A&M Epidemiological Investigation of SARS-CoV-2 Infection in Household Pets, is by Dr. Sarah A. Hamer. Please begin when you're ready.
Great, thank you to the organizers for inviting me. I'd like to start by acknowledging our collaborators on the project. From Texas A&M, this includes researchers at the Veterinary School, which is where I'm located, as well as Department of Entomology and the Health Science Center. We've been working also with Brazos County Health District and the Texas Department of State Health Services, as well as the Texas Animal Health Commission. And for laboratory support, we've been working not only in our own lab at Texas A&M, but also with the USDA NVSL, and more recently, the Wisconsin Veterinary Diagnostic Lab. And finally, I wanted to acknowledge our collaborators from the CDC, especially those who were able to come and deploy and spend a week with us in August doing some household investigation work. Next slide, please. In preparing for the presentation, I asked my graduate students if they could send in a picture of themselves with their pet. And you can see that these pictures together really nicely illustrate that we have close relationships with our pets, spending a lot of time together. And it's, very logical to think about the zoonotic pathogens that might be transmitted from human to animal or animal to human at this interface. Next slide, please. What's becoming clear is there's a growing body of research on SARS-CoV-2 in animals. And as Dr. Guy mentioned in the last presentation, no shortage of passive sampling studies or case studies that show very clearly that pets, in many circumstances, can become infected with SARS-CoV-2. Furthermore, there's a growing number of experimental infection studies, like the study from Bosco Loth that is shown with the graph here that was recently published. This demonstrates, for example, that experimentally infected cats achieved high titers of the virus, were shedding the virus from their nasal passages, and in some cases, there was direct transmission from infected cats to uninfected cats. However, there's a limited number of active surveillance studies, active epidemiological investigations, to not only detect the number of positive or infected pets out there, but also, searching and unraveling the number of negative pets that are living in high-risk environments. Next slide, please. This is where our study at Texas A&M comes into play. We basically were looking to better understand the ecological and epidemiological role of pets in the transmission of SARS-CoV-2. We have several research questions, and some of them are shown here. What's the prevalence of animal infections? What's the relationship of the timing of animal infections relative to human infections? How about risk factors? Or can pets shed infectious virus? Furthermore, we wish to, partake in a longitudinal study over time, not just at one static time point, so we could investigate the duration of animal infections and the duration that animals might have neutralizing antibodies. Next slide, please. Our basic methods, our enrollment criteria is dogs, cats, and other domestic mammals that live in households where at least one person has already been diagnosed with COVID-19. And we've been doing most of our sampling right here in Brazos County in Central Texas, which is where Texas A&M University is. We have a partnership with the Brazos County Health Department. And through this partnership, we are provided contact information for local cases who are confirmed as positive with COVID-19, who own pets, and who have expressed an interest in learning more and potentially being involved with our household transmission study. And this relationship with the health department is facilitated by a couple of our research team members who have been volunteering with the health department since March. Next slide, please. Some of our field and lab team members from Texas A&M are shown here. And I just wanted to mention that the individuals on the top are largely responsible for all of the site visits, going into the homes, collecting samples from the animals, and then we bring these samples back to our lab, and our lab team gets to work with various molecular methods to diagnose infection. Next slide, please. We have a pet questionnaire that we spend a lot of time on the phone with pet owners prior to arranging our site visit. And you can see some of the information that we're interested in gathering here. Basic demographic information about each pet, how many pets are in the household, medical history, travel history, and of course the very important question, did your pet show any recent signs of illness that coincide with the human COVID-19 diagnosis? For example, coughing, sneezing, eye discharge, lethargy, diarrhea, etc. Next slide, please. The questionnaire goes on to gather some information about putative risk factors, like where does your pet sleep? During your time of self-isolation, were you sleeping in the same room, sharing food? Was your pet kissing or licking you? Next slide, please. Our household visits generally look like what you can see going on in some of these pictures. We do try to work outside when possible. That's never a problem with dogs, or indoor-outdoor cats, but sometimes with the indoor-only cats, we will work inside the house or even bring the cats into the back of our field truck where we can safely work with them in an enclosed environment. Next slide, please. In the field, we collect several swabs from each animal, including oral, nasal, conjunctival, rectal, and external fur swabs. We also take a blood sample. And then back in the laboratory, we subject these swab samples, which were collected into viral transport media, to a series of PCRs. The work done in our lab at Texas A&M and more recently at Wisconsin Veterinary Diagnostic Lab are essentially screening PCR work. And then we will forward any presumptive positive samples to the NVSL in Ames, Iowa for confirmatory PCR work and sequencing. Also at NVSL, any samples that have low CT values that are positive samples will be subjected to viral isolation efforts, and we test all serum samples for neutralizing antibodies. Any animals that are confirmed positive get reported at the national and international levels. Next slide, please. We're very happy with this chain of communication about results. Our Texas A&M research team is allowed to share with the pet owners a presumptive positive diagnosis so that those pet owners might take actions to isolate their pets. Then the presumptive positive samples are forwarded to NVSL only with the permission of the state epidemiologist as well as the state public health veterinarian. So we communicate our results with those two state level agencies. If NVSL confirms positive status, they will report these results back to the state and to our research team, and we can then follow up with the pet owners, at which time we're very eager to schedule resamples to get to the households and sample those pets again. And then independently, the Texas State Health Department will follow up with the pet owners and ask a series of questions, the case investigation form that Dr. Guy presented in the last presentation. Next slide, please. Okay, so in terms of results, As of last week, we sampled 274 pets representing 137 different houses. And this is work that's been going on since late June until present day. What I am going to focus on are the 77 initial pets in our study from 40 different households. And these were sampled until the end of July. And we have complete data from initial plus follow-up visits on all of these pets. And I can let you know that in all of these cases, we sampled the pets anywhere from 1 to 27 days after the human's positive test result, with a median time interval of 8 days. Next slide, please. From these 77 pets, we were able to detect viral RNA positives that meet the case definition in 4 animals. This is 3 cats, so 16.7% of the cats, 1 which was also positive for infectious virus through viral isolation methods, and a single dog, which is 1.7% of the dogs that we tested. In total, this was 10% of the households that had confirmed PCR positive animals. Next slide. We also confirmed neutralizing antibodies in several animals. Next slide. This was 8 dogs and 8 cats. So you can see here over 40% of those cats were positive for neutralizing antibodies. In addition, you'll see that bullet point there that there were 2 animals that were PCR positive, but only based on their external fur swabs. And so these animals do not meet case definition and likely reflect a contaminated environment. Next slide, please. And while it's not a statistically significant difference, I thought it was worth noting that the median number of days between human diagnosis and pet sampling for the homes that had a PCR positive pet was 6 days, in contrast to the homes that had all PCR negative pets, which was a little bit longer at 8 days. Next slide, please. This graph here might look a little bit complicated, but I'm just going to pull out a couple data points. What we can see, this is depicting sampling over time at 6 different households that had multiple pets in each household, where at least 1 pet was associated with initial positive diagnosis. That's what's depicted on the y-axis, are the different households. And then along the x-axis is the number of days since the human COVID-19 diagnosis. And each symbol represents a time point where we collected samples. So I want to draw your attention to 2 households. The first is house E. And what we can see there is this is a household that had 2 dogs and a cat. And at first sampling, which was 6 days after the owner's diagnosis, 1 of those 3 pets was PCR positive. It was the cat, and that also happened to be the cat that was positive for viral isolation. We can zoom forward and see by the second time we visited that household, all 3 pets were positive for neutralizing antibodies, and that cat maintained its PCR positive status on at least 1 of the screening assays. By the third time we visited that cat, its viral neutralization titer had increased and it converted to PCR negative, and the neutralization titer continued to increase all the way to 1 to 2048 by the 4th sampling event. The second and final house I wanted to draw your attention to is household S. In this house, there's 2 dogs that live together. And at the first sampling, which was about 9 days after the owner's diagnosis, both dogs were PCR positive, but only based on their fur swabs. And when we went to revisit them, they were PCR negative, and in no time point were there the development of neutralizing antibodies. And so this is just a good indication that, yes, these dogs are living in a contaminated environment, potentially with symptomatic owners, and had the viral RNA on their fur, but is not likely to reflect an actual infection of the pet. Next slide, please. The last data slide I have here is just about pet symptoms. And I'm really pleased to say that symptoms were really rare in our study. So all 4 of the confirmed PCR positive pets were reported by their owners to be asymptomatic prior to the time of our initial sampling. However, 1 of those cats, which is Hilo, shown in the top picture, the owner called us after we sampled and said her cat spent about 3 days sneezing, and another reported to be a bit sleepier than normal for a couple weeks following our initial visit. Among the animals that were positive for neutralizing antibodies, there were 16 of them, only a single dog was reported to sneeze prior to our sampling. However, upon resampling, all of the animals were reported to be in good health. Next slide, please. So again, with that, I wanted to thank all of the collaborators who I mentioned earlier, and our investigation is very much ongoing with some more site visits planned for this afternoon. Next slide, please. Thank you.
Thank you, Dr. Hamer, and thanks to all of today's speakers for their informative presentations. We unfortunately are at the top of the hour and don't have time for any questions, but if you do have questions for today's presenters, we've included their email addresses on this slide on the ZOHU Call webpage for today's webinar and in today's email newsletter. Thank you for your participation. This ends today's webinar.